now.
Excellent. Very good. So obviously, everyone, we're recording this and we'll make it available for asynchronous viewing for all of those who haven't been able to join us. Again, my first point is always a thank you. I think everyone on the call I know, but again, I'm Michael Giuliano. I'm one of the assistant deans at the school, and this is part of a webinar series that we've been doing specifically for the longitudinal clinical preceptors. And again, it's the first contact the students are having in the clinical environment. It's absolutely critical to their development, and especially now that we've got a little bit of the COVID restrictions at least partly lifted. It's wonderful that they're out in your offices and doing things. I would want to attest, much of what we're talking about tonight was developed along with Elizabeth Koltz, who's the Director of Curriculum and Implementation and Design, and Dr. Ophelia Martinez, who usually would be actually running this seminar, but she's out with a family illness, so she won't be joining us tonight. But she certainly sends her regards as well. And then, of course, I'll let the rest of the faculty development team introduce themselves as they do the serial presentations on specifically the issue of the structure of giving feedback and organizing teaching, out in the clinical environment where you're seeing patients and with our students. So with no further ado, let's just touch on the agenda very quickly. We're just going to do a quick overview of feedback, and again, talk a little bit about the 1 Minute Learner again, just as giving the overall architecture of the models that we're proposing for teaching. We're going to spend the bulk of our time actually going through the Forward with Feedback model, which was developed here at the school, and really you have an opportunity to sort of play with that model a little bit in breakout sessions and role play, and then we'll do a little bit of a debrief when we finish. Next slide. Hopefully you know everybody on this team. Everyone on here is here except Dr. Martinez, and of course Dr. Hoffman as well, who's the Senior Associate Dean, who is actually the author of the 1 Minute Learner model that we'll be utilizing. And Beth snuck in. Dan's the coordinator, so you may have been interacting with Dan in the logistical parts of this, and I guess we have to sneak in a picture of Elizabeth Koltz when we get a chance. Next slide. So again, always begin the world with learning objectives. We're going to look at some models for feedback, so to talk about the old classic ND model that has been utilized for a long time, which has not been totally thrown away. But again, I think there's some aspects of that model that I think hopefully we've improved on. We'll talk a little bit about some of the common pitfalls of giving feedback. And most importantly, we'll spend most of our time really talking about the Forward with Feedback model and its focus on growth, and we'll hopefully have an opportunity to actually demonstrate it and use it in role play. So it's pretty straightforward objectives. Very good.
All right, so I'll get started. So just a quick definition of feedback. It's the process of giving data back to the learner, and more importantly, it's
Francisco,
for the purpose.
just introduce yourself. I purposely left out the introductions until you started talking.
No problem, sorry. Hi, I'm Francisco Arrocho. I'm one of the new faculty development trainers, and I'm happy to work with you all. So just to go back, we'll start with the definition of feedback, and it's the process of giving data back to the learner, and more importantly, for the purpose of bringing about change. And it is the beating heart of learning and teaching. And as we know, feedback can be given too cold or too hot. So it can be overwhelming at times if you're giving feedback to someone, or if you're receiving feedback from someone that can be very critical and it can be a lot, or it can be very cold, not enough information. So, for example, telling someone you did good, or giving just a list of everything that they did wrong. The student can sometimes be overwhelmed by that. So how do we get it right? Well, we first start by making it respectful, actionable, and in a way that helps us grow. And we'll go a little bit more into detail on that. So I just wanted to start the conversation. What are some examples of feedback that you've received or you've seen be given that was unhelpful or bad? It could be anything you've seen. It doesn't have to be related to the work. It could be anything you've seen outside, in school, anything like that.
My own personal pet peeve of feedback that I think is really unhelpful to learners is you need to read more. That's the one that I always try to encourage to stay away from, because it's really not helpful to the learner.
Definitely. Anything else?
I took a lesson in golf one time, and the instructor said, "All right, go swing. I want to just watch you swing." And he started laughing at me. He was hysterical laughing. And it wasn't a complimentary laugh. It was like, "Oh my God, how bad could you be?"
Well, hopefully he stopped laughing and then gave you some specific feedback to what you could do better. So
actually, I think he just shook his head. He sort of said, "Oh my, there's no way I can help you." Something along those lines.
well, that's a form of feedback. It may not be very.
Oh, it was
positive.
a form of feedback, all right. Wasn't very actionable though.
Yeah. So I think the typical feedback is you're doing a great job. Keep it up. And so you really have no idea of what you can do better or what you need to improve upon.
Definitely.
When I was rotating through surgery, I was scrubbed into a case, and the surgeon was pimping me on esoteric nerves and anatomy, and I knew almost none of the answers. And eventually, and I was trying to leave early because it was actually one of the Jewish holidays, and he would not let me leave. And eventually he just got annoyed that I didn't know any of the answers. And he said, "Well, go home and tell your parents that they wasted their money on sending you to medical school."
Wow.
So that was actionable, right? I mean, there was an action I was supposed to do.
There was an action.
There was an action there.
Did it provide you good value though? Was it a good value, the feedback?
No, I just decided that he was an asshole.
Yeah, that works. That's good value.
That's accurate.
I think it was a rational assessment on my part.
Absolutely. So we can go into now, what are some good examples of feedback, or the most useful advice maybe you've received, or some type of qualities that you think are helpful in feedback?
I think it was touched on already, but I'll give an example of helpful feedback. I always find it helpful when someone's able to give me feedback on a direct observation. Sorry about that. Emergency alert again. So if they're watching me do something, or they know I do something, give me example of feedback of what they saw and then how to change it. So I'll use the golf coach. I was playing golf with my friend the other day, and actually I think it was Doug who told me this one. I was rushing my swing. I was coming down too quick, and Doug was saying you really got to have a more even tempo, and it helped a lot on my drive. So when they're able to sit there, watch what I was doing wrong, and then tell me exactly what I have to do to try and make it better and make that change, then it becomes my responsibility to go on and do it. So they're able to observe and then give me direct feedback. It helps.
Awesome. Anyone else?
I would just say that I actually had some similar, so when I was starting here as a faculty development trainer, I remember I was talking to Dr. G about just describing the curriculum, and I was having a difficult time in terms of how to organize things and what the acronyms for different resources were. And he pointed me in the direction of basically our graphics that show the curriculum built out, and lots of other specific resources that I was then able to study and then kind of come back to it. So it basically addressed all of the specific issues that I was not clear on, and it gave me an obvious plan to work on to grow from there.
Awesome. So we'll move on into describe some of that helpful feedback, what kind of qualities we might be able to find in that. So feedback should be expected. So set at a certain time. It's helpful for the student to know when they're getting feedback, so that way it kind of reduces anxiety and also gives them time to prep for that feedback session. Maybe we'll talk a little bit more about how to involve them in the process, but having them prepare what they think they can do. It should be well-timed, ideally soon after the observation of behavior, and it should be based on firsthand observed data, the observable behavior that you've seen. And it should be also regulated in quantity. So kind of like that Goldilocks feedback where it's not too much, not too little, it's just right, and depending on the needs of that learner. Feedback should also be descriptive and non-judgmental. You want to make sure that you're being as objective as possible when providing that feedback. For example, if somebody's quiet, you don't want to tell them that they're shy or introverted. You want to say, hey, I noticed that you're a little bit more reserved here. Do you have any feedback, or do you have any observations that you made? Kind of involving them in the process rather than passing on that judgment, which might actually make them more quiet. It's also concerned with decisions and actions, not assumed intentions, and also limited to remedial behaviors, things that they can work on, not personality traits.
That last point's pretty important there, the not personality traits. So if it's how the person just is, you can't really give feedback on, you got to change your whole personality. It doesn't work that well, but behavior is where we can get going a little bit better.
Dr. G wrote, let's go Mets.
We're not gonna be able to fix that, unfortunately.
On the, the other question I sort of have with this that I'd be interested to hear what the group thinks is I think it's a fine line if you're observing actions that are maybe a little reflecting on somebody's personality style. I think, if you're giving it in the terms of this is what I've observed and this is how other people may take what you're saying, I still think you can sort of get at some personality traits. Like, so for instance, somebody who's coming off as arrogant, again, I'm not judging their personality, but I'm making an observation on how what they're saying might be perceived by me or by others. So I feel like you can do that if you're couching it in something that is really observable and maybe something that they're not fully aware of, even though, they may be arrogant and that may be a personality characteristic of them. But again, I don't think that's their intention in the moment.
Right, and that goes a lot into the behavior that you're observing. So I'll use Dr. G, he's gonna hate me for this, but I'll use him as the example. When he says, quite frankly, can come off as sometimes condescending or obviously, but that's where you say, let's change our language. You might not realize how the patient's perceiving, you're saying, oh, obviously that's what's causing this discomfort. It makes it sound like they're lesser, they're not as smart because they're not seeing it. Same with you're working with a student who maybe comes off cold to patients, they're taking histories. So trying to, how do you build up that patient interaction where you're more open and you come across less cold to them? That could be the personality. It could be a very reserved, closed off person, but we want to try and work on that. So those are instances where you're right, Dr. Gottdiner, that we could.
Yeah, I would agree with that. I had a student who, she was very quiet. She didn't really seem to know what was going on. And I started to question her and ask her different questions about patients and about information. And it turned out that she really had all the answers. She was really quite bright and really knew what was happening. So I tried to encourage her to be more confident and to not be so reserved, to realize that she really was capable of doing what she was trying to do, that she was capable of asking the right questions to the patients, and that she did understand the not only what was going on clinically, but also pathophysiology and everything else with the circumstances we were under. So I think that we can address their personality traits to an extent and try to build them up and make them better able to function.
I agree with that. So when giving feedback, we, like I mentioned before, we should enlist the learner's perspective. So involving them in that process, asking them, how do you think you did? What are some of your strengths that you think that you have? What are some of your weaknesses? Involving them in the process helps them able to grow and learn from each feedback session that you give them. It also provides guidance to resolve problems. You can to further improve in those future evaluation sessions. And then next, you should have a defined timeline for implementing change and reevaluation. So in that feedback session, saying, okay, we're going to focus on this, and the next time we meet, we're going to see how that skill develops. So, for example, if they were quiet, asking them, seeing how more involved they are in the next process. And then another way of looking at feedback is a sandwich model, where sometimes feedback is given with positively, then that corrective feedback is given, and then positive feedback is given again, kind of like a sandwich. And while this model might help in terms of helping them not overwhelm them, it doesn't bring change or improvement, and it's not enough. So we'll get into those models that will help with bringing in change and improvement.
A lot of big issue with this model too, I see all the time when I used to teach, they always said, oh, give positive, negative, and then a positive again, so that way they stay happy. Is the students really only listen to the positive and they completely throw out the negative? Oh, I'm doing everything well, I had one thing wrong. You got to sometimes have to drive the bus back and highlight that there is a spot we can make improvement.
Okay, so hi again, everybody. This is Doug. I'm another one of the faculty development trainers, and we're just going to touch briefly. We're going to kind of take a step back and review the 1 minute learner model, which we have discussed in a previous webinar for the LCP program. And it's developed by Miriam Hoffman, who's the Senior Associate Dean for Medical Education here at the School of Medicine. And it's really the foundational model for structuring goals and expectations with your students. So this is kind of the core of the teaching models, and we'll discuss how the feedback is a component of this. So just a quick look at the 7 steps again. Now, assuming everybody here has worked with their students several times, likely steps number 2 through 6 have been discussed. So in theory, you would have had a conversation with your student on the first few visits about how the day should flow and what the different administrative elements were, when they'd be presenting, what kind of patients they would be seeing, and so on. Today, the pieces that we're really concerned about is step number 1 and step number 7. So the feedback is the final step in the 1 minute learner. And in the specific things that you want to consider with your student is when and how you're going to give them that feedback. So is it going to be real time as they're actually seeing a patient or at the end of the day? Are you going to review the feedback summatively or formatively? In terms of debriefing the session, so discussing how they did with that particular patient. Now, the last bullet is possibly the most important one, and that is, were the goals met? So you're discussing the next steps in learning. So we're going to get more into feedback in the subsequent slides, but the things that I would like you to really hone in on is the fact that the feedback conversation is a loop. It connects with the goals for the following session. So you're going to go through this process of developing a relationship in which you provide feedback and develop a coaching plan that results in goals with your student. That conversation fuels the next visit. So these steps are going to work in tandem with one another to kind of give you a very structured way to progress each of those patient visits. So I think Joe is going to jump into the forward feedback model.
All right, so I'm going to touch base on the forward feedback model, and Doug did a really good job there of setting the table here. So we've presented to you many times before the 1 minute learner, where the first step is the goals and the last step's the feedback. This model is built out so it fits in there. It's not another model you have to remember and use. It slides right into that 1 minute learner, and it makes it pretty easy when we go to give feedback. Always we have to go through and attest where this model came from. You'll see there some individuals at the School of Medicine here who developed this model, as well as where it came from originally, and that's the R2C2 model. So it helps build out that learning there. So we go back in, as Frankie said in the beginning, feedback should be specific, right? We want to make sure it's detailed. We don't want to leave it vague. We don't want to have the example from Alexander Gottdiner that's on the slide there. Read more. That doesn't help a student in your placement. It doesn't help them as they're rotating through. Oh, good job today. Go read more. Well, it's not actionable. It's not specific. And that's what the forward feedback model really go in and help. And the other big thing when giving feedback is we need to focus on what, not why. So focus on specific observed actions, what you saw, how they can go through and change it, not why you think someone did something. So Dr. Percy has a student with them, and they see that when they're presenting on the patient, they're focusing way too much. They're skipping aspects of history. Dr. Percy's not going to go in and say, well, I think you're skipping this because you really don't think it's important. That Dr. Percy is going to ask the student, oh, now why did you skip over this when you're taking the history? Why did you skip over their past family illness? You kind of didn't ask that. You focused purely on the patient's own history instead of their family history. Is there a reason for that? And then the student is now accessing, well, oh, wait, why did I do that? Maybe they're not realizing it. Maybe they thought it wasn't important, and they can get at the real root of the issue. So that those what questions, though not the, oh, well, I think you did this instead. So this, as we said, is the formative feedback model. Like Doug described it, is a circular model. So it fits nicely in this logo of the circle. It's a bidirectional communication model, and this is all purely based on developing those working relationships with the students with a common culture of growth, personal growth. So we're starting off that first step of the 1 Minute Learner, the identify goals, the first step in the formative feedback model. What was your goal today? When you came into the office today, let's restate, what was your goal? What were you trying to get out of your patient encounter? Oh, well, my goal was to really focus on, I wanted to get better at doing the physical exam, and I wanted to get better at making the patient comfortable while doing that. They're restating that goal from the beginning. So when we go to give feedback, that goal is fresh in our mind. And then we go into, well, how do you think you did? How do you think you did when you did that physical exam that we said that was your goal? And they're able to come up with a self-assessment. Sometimes your self-assessment you see in there, they may be spot on. They may say, well, you know, I did a good job, but I need to work on X, Y, and Z. Well, there you go. That's what we need to do. Sometimes the students are hard on themselves. A lot of the times they are. The students are too negative. If it's like me, I'm always negative. Doug's seen this with working with me. He's seen it on the golf course. I'm very negative of how I think I'm doing. So they might be too hard on themselves. And that's where you say, well, no, you're not. You're actually doing pretty well. We just need to focus a little bit more on this. And then we can get to X, Y, and Z here. Or they might be super inflated with their ego. They might be one who thinks they're a rock star. Oh, my parents are doctors. I've been doing this for a while. I think I know exactly what I'm doing. This is great. And that's where you have to play the bad guy a little bit and kind of go in and say, well, let's take a step back. Here's actually where we need to get at. You need to work on this still. So that self-assessment really helps set the stage on that communication you're going to have there. So they do their self-assessment, ask them how they thought they did. And this is where the big part comes in, right? And this is the observations. This is where you state what you observed before you give your exact feedback. So one thing I observed in your patient encounter was that you didn't spend time introducing yourself and letting the patient know who you are. You went in and started asking questions. That's not how we want to do that. Is there a reason why you skipped over that? It's something to be aware of moving forward. So where you state what you saw that they did well, and that's this part of the plan. Oh, I went the wrong way there. Then we come up with the coaching plan. So we're going to talk about coaching plans in a minute. Those are the next steps. And those are going to be the action items after you have your debrief there. So you went through, the student assessed what they did. We talked about their goal. You gave their feedback. That's where you coach. So you're going to possibly ask the learner, what do you think you can do to improve? Now that I gave you this feedback, what steps do you think you can take to make an improvement in what we discussed? What that does, and this goes back again to the heart of the School of Medicine, that's making learners who are self-directed, right? Self-directed lifelong learners. They're taking ownership of their process, and again, it's a bidirectional model, so now they're having a say in what they think they need to improve upon. And that's where you're able to go in with input, maybe provide resources, guide them on where they need to go. So let's say, Dr. Gottdiner, you're right, your student does actually need to read more, right? Now we can say, you know, I struggled with this when I was in med school. I went through and I read this textbook on anatomy and focusing on orthopedic and the knee. And I think this might help you. I think you're struggling with understanding the basic functions. Take this, go read this book that I read. This helped me a lot. Or guide them into, oh, you should go look up this. And then you're kind of guiding them in there. You're not saying go read more with all right, now I'm going to go read everything ever written on this, but you're kind of giving specific feedback. And that's where you're able to guide them with resources. And then the biggest part there is number 3. If you give feedback and you come up with a coaching plan and you don't have number 3, you don't have agree on a follow-up plan, there's no point in doing this. The process is a waste. You can't give feedback without having it being followed up in some way. It creates accountability. And it actually just it makes you want to go and actually do it. I've gotten feedback before. I'm like, oh, that's great. I've never followed up on it because there was no follow-up plan. There was no accountability. If you get that feedback, you need to make sure there's a plan to follow up. And it could be as simple as next time you come in here or your next patient encounter, we're going to work on this. It could be go do this, look this up, send me an email and let me know what you found. Then there's in between the visits. It's a little bit tough right now because the visits are once a month. So you need to find out a way to get a plan in there in place. So now we're going to talk about coaching plans. And I think anytime you go to do a coaching plan, we're going to say this all the time, they need to be smart, your plans, right? So specific, measurable, attainable, relevant, and time-based. What are we doing? That's going to be specific. How are we going to measure this? They're going to come in, they're going to try this skill, you're going to observe it. Some way for it to be measurable so you're able to see improvement. It needs to be attainable. It can't be so big picture out there that they're not going to be able to accomplish it. It needs to be relevant to their learning and where their strengths and weaknesses are. And it needs to be timely. It can't be, again, a long-term 4-year process, because you're not going to be working with the students for those 4 years. If it's a skill that we're working on right now, it should be something by the end of LCP. Now, again, here's observable changes, specific observable changes you tend to make from the feedback session. What's your goal for each? How will you do it? And how do you know when the goal is achieved? We just talked about this. Coaching plans will vary depending on where you are in the development and the relationship with your student. Sometimes if you're early on in that relationship, your coaching plan is not going to be as in-depth. You need to build up that trust, that professional working relationship with the student first. There needs to be specific learning objectives as it focuses on a specific skill, more complex, and they need to mature over time. So we should be seeing growth every plan that we have. So those plans need to mature. We need to see them get deeper and deeper as they go throughout the process. I want to talk a little bit about deliberate practice, right? So we can talk about practice all the time. You can go out, you can do it over and over and over, but if you're not doing it with a deliberate, intended outcome, there's no reason to do it over. You can do it over and over if you want, but if there's no certain goal in mind, they're not going to get anything out of it. So when you go to have them practice it and over, make sure that there is some sort of carrot they're looking for, so that way they can make sure they're actually striving for growth. I always think back to I had a cross-country coach, and we used to go to the weight room, and you just lift weights. It's great, but if you're not lifting it correctly using the proper form, you're not really getting any growth out of it. So you want to make sure your students are doing it correct. You can practice wrong all you want, but it's not actually going to help them. Make sure when you do deliberate practice, you're identifying what's wrong first, and you're testing new strategies each time, and you're integrating those into the overall process of what you're doing, measuring it, and you're getting that feedback again and going back and trying again. Everyone should have the growth mindset, right? Everyone's coming in every day, they're showing up, so they should be trying to get better at something. They're not fixed mindsets, right? So they're not saying they're not going to make any changes. The whole goal of medical school is to get better and grow, so we're hoping that everyone has that growth mindset. We don't want to see them be that dropout, right? And most of the time, the students, if they're showing up every day, they're not going to be that dropout. They might be like me throughout most of my college career until I actually decided to try the okay plateau, where I was like, oh, I don't really need to read. I'm doing okay in this class. Until one time I was like, you know what? I actually have to start reading. And then I decided to go on the expert route there. You're never really an expert, but it's more of you're trying to grow. So we want to make sure the students aren't at that okay plateau, right? Where, hey, I'm doing great on my LCP patient encounters. There's nothing going wrong. They're just doing it over and over. We want to keep giving them a new goal to keep helping them drive down the road. So in this presentation, we've thrown a lot at you, right? We've thrown out the 1-minute learner, the forward feedback model, and how it integrates with the 1-minute learner. And they both give a structure for real-time teaching with a focus on feedback. Now, this wouldn't be a good educational setting right now if we just talked to you for a full hour and we didn't give you time to practice, right? So we're actually going to give everyone time to go in and practice. So we're going to do a breakout activity. So let me review this with everyone first. So we're going to be splitting everyone up into groups of 3. So we'll be able to go in and we'll be able to have these interactions, and you're going to model and actually role play out giving feedback to the student. So one person's going to play the role of the student, the other will play the role of the instructor, and you're going to practice utilizing the concepts of the forward feedback model to develop a coaching plan and goals. The scenario we're going to use is that your LCP2 student or LCP student just completed seeing a patient. This is a focused visit for a cold and fever, and the student's primary goal was to do a succinct presentation about the pertinent findings in a short period of time. This was their explicit goal. Instead, the student put a ton of extra detail in. Their presentation was over 7 minutes, when instead we told them we wanted a 3-minute presentation, and there were way too many details. There's no coherent editing or structure. The student did have 2 to 3 reasonable differentials, and the student is now interested in hearing your feedback on their performance. So again, you just had this encounter with the student, and this is how they present it to you. They gave you 7 minutes. It was not very coherent. It wasn't very structured. It was detailed, but there was too many details. And they did have 2 to 3 reasonable differentials, though, which was good. First step, right? We knew the goal is to go in and trying to do a succinct presentation. The student did their self-assessment. This is their self-assessment. They said that they did very well. They included all the relevant information, and they thought they were on the time target for the feedback session. And they were really afraid about leaving out critical information. That was a worry, so that's why they really went in and put a lot in there. And then the student reaction for those when you do the role play as a student is that you're very receptive to feedback. So this isn't a student who is closed off and not receptive. This is a student who is going to be receptive to feedback. So before we send you into the breakout rooms, I just want to ask, is there any questions about what our objective is here?
Just so everybody knows, since there are a couple people dropping off, we're just going to do 2 breakout rooms. So we'll be in each one of them to assist with that conversation.
Perfect.
Feedback is you've been very explicit about what we're supposed to do.
Perfect. All right, Doug, you're running the bus on the breakout rooms, correct?
Yep. So I'm going to push us out in a minute, and then we'll come back at maybe 6:33 or 6:35 or so.
And as Doug pushes us out there, I'll say I personally, I'm not the biggest fan of doing role plays, but they do help. So if you're serious about it and really try and give that feedback like you're actually working with the student, you do get a lot out of it. And we've seen the benefits of this in previous workshops of other faculty. So there's a lot of value to this.
I'm going to open the rooms right now.
I'll join the same one as you so we don't have to worry about the whole.
I'll join room 3 with Dr. G then.
I was with a third-year resident, and I said, okay, so we're only going to be together today. What's your learning goals today? And she looked at me like, what? I want to manage patients better. I went, well, let's
That's kind of vague.
let's get more specific. And then I said, so what are you having trouble with? Why don't we go there first? What is common, important, and you're having trouble with that you want to work on and get better at? I said, what issues keep coming up? And immediately she came right to basic fluid and electrolyte management of every
Observation.
patient. Every circumstance was a little bit different. And we ended up basically doing rounds this morning, focused purely on basic fluid and electrolytes from every perspective. One patient was post-op, one patient brand new and diuresing, one patient has chronic lung disease and is fluid restricted. So they got to sort of see it from all those angles. Everybody back?
All right, so we'll go into the debrief. So how did that feedback session go?
As you said, it was helpful to do a quick practice, just to kind of reinforce the process. So thank you for that.
Well, what did we find difficult? I think in our group we saw some difficult issues of giving feedback. What's difficult when we go to give the feedback? What are some things that we're struggled with?
No, I think the biggest thing is you don't want to make the person feel bad. And so you sometimes temper things rather than being explicit about behaviors. And I think that's where you come back to what you talked about earlier, separating the personality from the performance, if you will. It's not about you as an individual, it's about what you did. And it's not necessarily negative. So as we've been talking today, one of the things that I've been thinking about is that we're focusing on us as the provider of feedback, but how about the student or the individuals receiving feedback and their mindset and where they are? And we sometimes talk about the person that thinks they're doing a great job and how you overcome that. But how do you get somebody into a frame of mind, which is that I need to be receptive to feedback, and that I'm going to get some positive things and I'm going to get some things that I might be able to improve upon. So I'd be interested in that, and what you guys think as coaches is how you get students to that point.
I would.
Some of us are more receptive to it than others are.
I could just jump in very quickly. So one of my first thoughts as you were describing that was, to me, that emphasizes the importance of the 1 minute learner and the way that that can help you build a trusting rapport with the patient. So if you demonstrate that you're somebody who is very thoughtful with how that student's entire experience is going and continues to be, and you structure the nature of feedback conversations as one of, you're doing it so that you can come up with goals to keep their sessions progressing. So I think a big part of it speaks to the importance of, again, showing that student that you are there for them. You're going to go through this nice structured process and they trust you. I think that foundation is critical in terms of how the student is to what frame of mind they'll be in when they receive the feedback. That's one thing I would add.
I mean, I think another thing to do, which I did with my last students, was to let them know that we're going to give each other feedback, and I sometimes have them give me feedback first. So they feel they should let me know what they would prefer, how is it going, so that they know that it's a two-way street and it's just a process of how we can get better. And I actually volunteer. So you tell me what you think about how I was in the room with the patients. Did I rush? Did you think I was rushing? Do you think that you could do what I did? Do you think that you are learning from what I'm doing? Would you prefer me to step out of the room? Things like that. And then they think it's a two-way street, and then they don't find that they are on the spot. They know that it's an exercise.
That's a great method to use there, because you're breaking down that barrier of, I'm the preceptor, I'm here to work and just observe you and give you feedback. You're making it more of a team, a collaborative approach, which is really what our models try and drive home there. It's a collaborative process.
Dr. Desai, could you just comment, if you don't mind, on how you approach this and sort of what your experience has been with feedback in the past?
Yeah, so usually, I mean, usually I do the similar thing that the other physician mentioned about, when they first come in, ask them, what they want to do differently this time, or if there's any new goals that they have that they want to work on, any new things that they want to work on. And then, we talk a little bit about their previous presentation to see, if there's any questions that they had about that, or any ways that I could help them, understand what I had given as my feedback to them. And then I asked them the same thing, like, is there anything I can do differently in terms of, trying to help you with those trouble spots, whatever things that I had previously pointed out. Is there things that we can do differently to try to understand? And then that's pretty much it. And then from there, we usually are able to, see where to go.
Yeah, and I think Steve's question is critical. How do you create that environment where they become receptive? And I know for myself, self criticism, openness to one's own faults and needs to do stuff. Today on rounds, initially when I was starting to do some of the stuff I was talking about, they were a little sort of on their heels because we were discussing stuff they didn't know much about. And then a subject came up about congenital teratomas, which I haven't seen in 20 years. And I openly admitted to them, I haven't seen this in 20 years. I have no idea about what's been going on in the literature about this. I have no idea what the next steps are. Teach me, and who's going to go learn about it and teach you. So again, modeling the thing you want to see, the willingness to accept feedback, and the willingness to, indeed admit your own ignorance and grow, I think is so critical. The easiest thing for us to do is say, great job. And, that's not doing our job.
So I like the point that somebody made about, having the goals. I'm not sure I've been doing that as well as I should with my students. I may have talked a little bit about what I wanted to do as we went through the 6 different sessions, but I think coming out of a session, as I do it over the next few weeks, what I'll do is to ask them, what do you want to do next? So I can create a situation where they'll be able to do that. And so we'll have an explicit goal that they have in mind. And then that'll really set us up for the feedback session, as opposed to making it kind of a broad, wide open, okay, let's go see some patients. And maybe you see some interesting things, but you don't get to really build on the skills that you might want to be working on.
I think that's especially important in LCP, in an environment where you're not seeing them as much as you would be in a weekly class setting, as in 3PC or any of the other courses. So this allows them to kind of come in with what they're working on seeing in clinical skills and apply it in that real world. So now you're able to make a goal towards that, and it allows them to come up and take ownership over the direction as well. So it might help.
Steve, I think that's exactly right. And that's why, when we were doing the session, the key in the feedback model and the key in the 1-minute learner is the huddle and the initial goals, and make them clear. So you're all on the same page, the same expectations about what we're trying to accomplish. And especially for the LCP2, the LCP1 students, is that, those things may be relatively simple, but it's important to know exactly what they are. I think that makes all the sense in the world. We're almost at the end of time, so let's turn to sort of just wrap up real quickly. I think this is all fundamentally about continuous improvement and excellence. I mean, again, with observation that's done well with an evaluation tool, coupled with coaching and feedback, those elements are so critical. And when used properly with time and repeated coaching, I think that's how you climb higher and higher and develop greater and greater skills. And if you throw in a team of people doing it, I think ultimately you lead to a lifetime of of excellence. And that's really what we're aiming for not only for our students, but for ourselves. This is a learning process for all of us. And just, I want to make certain everyone, next slide. I just want to be sure that everybody saves the dates. You know, we'll be doing the 5th and 6th webinars in this series. The next one will be on August 19th, again, 5:45 to 6:45. And we're going to touch on the assessment tools because, again, all of us are going to be required to assess the students that we've been interacting with. Hopefully you're doing evaluations of their write-ups as they're going through. And we'll talk a little bit about how that's been going and how the coaching plans have been basically going with the students. And then on the number 6 webinar will be basically your turn, you know, for an opportunity for us to discuss how the overall program went and help to guide us to make things better as we move forward to the next cycle. Interestingly enough, the next cycle is right in front of us. We're talking about the next cycle beginning in January, which is really not very far off. Believe it or not, it's a little scary to think, but time's moving quickly. So the next cohort of students are already started, and they'll be trying to begin their LCP experience in January. So hopefully we'll get everybody involved in that, and you'll help us form some improvements in it. And with that, any residual questions, please let me know, but I want to be respectful of the time. It is exactly 6:45, so that's fantastic. Any questions?